Yeah, my name is Gerald Bush. I grew up in on the White Mountain Apache Reservation. My dad's full-blooded White Mountain, and my mom's Navajo. But we grew up in the Turkey Creek area. I went to high school at East Fork and did my college, undergraduate, and medical school in Tucson at the University of Arizona.
Wow, all at ULA Wildcat. Okay, so thank you for talking with me for a few minutes. I just want to respect your time and keep it focused in the scope of the work that we're talking about today. So the floor is yours. I just want to, I guess, frame the conversation around you as a medical provider, as well as a member of the White Mountain Apache community, raised culturally and socially and politically and all of that intertwined in your upbringing. What has this COVID-19 phenomenon or global pandemic, what has it meant for you to see a global pandemic impact your own community, and rather our community? And also, what do you want the world to know? So go ahead, no pressure.
Yeah, okay. Yeah, thanks for asking me to come on this call. It's this coronavirus, also the disease that it causes, call it COVID-19. It started, way over in China and kind of made its way all over the world, which, it's a very, in medical terms, a very transmissible disease. It transmits between person to person very easily. And the virus itself is very tricky. I don't know how to describe it. It hides very well. People get infected and they don't know that they're infected, and they start giving it to other people unknowingly. So that's one of the things that is really puzzling about this virus, and very scary. And that's why we're seeing so many cases in the world. That's why it's a pandemic. And the reservation, as beautiful as it is, and it at times it can be very isolating, but we're still part of the world. Our little community is in northern Arizona, and it has really impacted all the tribal members, even to this day. I believe they're still in lockdown, which is one of the extreme measures that any community has taken. It's probably one of the most extreme in the whole country, I would think, other than the Navajo Nation, who has been doing the same thing. It's really caused a lot of changes for my fellow tribal members. So yeah.
Okay, thank you for that. Yes, it really puts into perspective the implications of and the cultural considerations of what this global pandemic and its impact has in our community, in our corner of the world, where we believe, that the center of our universe is within those sacred mountains. And so raised in that community and being educated and living off territory, what do you want your community or our community to know about, what do you want to say to them right now? My heart goes out to the whole community. My prayers,
I'm sure you know, I know so many people that have passed away from this virus. So it's really hits home for all of us, I think, on the reservation. And a lot of other people who have gotten infected as well, but have recovered. So, let's not forget about those people. And unfortunately, in Arizona, we are, I think the New York Times kind of highlighted that we're the worst hotspot in the whole world, Arizona. So that kind of puts into perspective, how bad this pandemic has grown here in Arizona. So yeah, to my family, fellow tribal members, I just want to encourage you guys to, keep doing what you're doing. Like I said, it's a very tricky virus. So from a medical perspective, there's no treatment for this. There's no magical drug. There's no antibiotic that we can give, for like pneumonia or some other like sinusitis or some other infection, meningitis. We can give antibiotics and people get better. But unfortunately, with this virus, there's no treatment. They're learning new things. I believe there's one drug called remdesivir that seems to be helping, but that's the only one drug. So I just want to encourage people. Just the only way to get to fight it, I guess, is I hate using social distance because that doesn't sound right. For me, I like saying physical distance because. Yes. As Native Americans, we're social people. We take care of our relatives. We take care of our neighbors. We check on our grandmothers and grandpa, our aunts and uncles. So I like saying physical distance instead of social distance. So keep doing that. Obviously, wearing masks, helps a lot. And unfortunately, staying home. If you don't need to go out and do things, I would just stay home. There's a lot of, you get to live on the reservation. It's so pretty there. So I would think it would be easy to stay home, but I know it's hard for some people. So just keep that in mind. There's not a lot of treatment still for this virus. Hopefully in time, the scientists and people are trying to get a vaccine, but the vaccine takes a while. So yeah.
Yeah, thank you. That's well said. Yes, I think I saw in the news that they're in the late stage, or correct me if I'm wrong, but one of the final phases of clinical test trials for a vaccine in 2021, or maybe even early 2021. But the point being, it's not in 2020. So as a medical provider, recognizing and looking at the data and seeing the impacts, and also coming from the community and knowing the historical trauma and the unresolved grief and the substance use, and recognizing through your training the model of harm reduction in the time of COVID. Do you have any thoughts or do you have anything that you want to weigh in around our response to COVID in terms of a harm reduction model, specifically towards our at-risk or our substance users, those types of patients?
Yeah, sure. That's a good question. I think it's, ideally you would, try to, they call it contact tracing. So if someone gets infected, then they come into the hospital or wherever. There's people there, epidemiologists or nurses or field nurses or whoever, can ask that person, hey, who did you talk to? Who have you been around? And they can go and talk to those people and, try to get a good idea of who could possibly be infected. And I know it's really hard on the reservation, especially if there's a lot of, alcoholics, active drug users that are not staying in place, not quarantining themselves, and who knows who they're coming in contact with. That's one of the things that's really, really, it's really concerning. And I don't know if anyone studied this, but that's probably one of the main culprits that's transmitting this virus on the reservation. So, and I think right now, they're doing okay because it looks like the police and the authorities are involved in clamping the reservation down. So hopefully this helps. That's all. We just need people to stay home and be careful, not be in big groups. Yeah.
Yeah. Okay. That makes sense to me. And I think the difficult piece, I guess, we'll just separate between, let's say, people with substance use disorder. That's the clinical terminology in the medical field for me as a licensed social worker. But people with SUD, alcohol, substance use disorder. Let's separate them from the general community for a second. And in our community, the White Mountain Apache Tribe, we, for one reason or another, which we don't have to get into, we tend to call people with alcohol who experience and suffer and deal with alcoholism, we call them camels. And that's a very problematic term, but it's part of our history. And so the camels are separate from, and I don't even like that term, but the people who are dealing with alcoholism and substance use, they're not the people going to Walmart every Tuesday and Thursday. So I guess what I want to say is that as much as our community is really shaming and shunning people who are really suffering with alcoholism, I come from a family of alcoholics. So I take personal offense when anyone shames or shuns, my alcohol intake, because that's coming from a place of pain. I'm going on a rant here, but my point is that most people who, like you're saying, Dr. Bush, that most people who have to do the contact tracing are your average, people who work in the community. They might work in the tribal headquarter office. They might work at BIA. They might work at the schools churches. So really, according to CNN and medical experts, a lot of the people who test positive are your everyday people and not, jail inmates. It's really your everyday people. So I don't know if you have anything to add to that as well, or if you want something else, you want to mention anything else.
Oh, yeah. I totally agree with you. Like I said, I like to call this a tricky virus, So someone gets infected, it takes about 4 to 5 days before they start feeling symptoms. So who knows what those symptoms are? It could be headaches, it could be feeling tired, runny nose, sore throat, slight fever. If you're young and vibrant and no health problems, then I'm sure, like a lot of us, will just be like, oh, I'll just, we'll just see what happens. Yeah. And then they get better. Most people get better, like younger, healthy people. And those are the people, that are really, you're right, are the ones that are spreading the virus because they don't know they have it. And they're still interacting with, other people, maybe not wearing a mask, maybe not washing their hands as much. Yeah, so this really has to be ingrained in every tribal member. And unfortunately, we're not seeing any. I hate to be political, but we're not seeing any leadership from the president. And it's like 30% of the country doesn't really care about, you know, the rest of the 70%, you know, that are trying to really clamp down on this virus. You know, they're listening to what the president is saying. You know, he's not wearing a mask. He's not telling people to stay home. He's doing the opposite. He's really pushing for everybody to go out and do things, and that's, in my opinion, that it's not really helping. But you know,
right.
that's
And the
my
evidence
little
is showing
rant.
that too. Go ahead.
Yeah, that's my little rant on the president. But
it's your opinion, and also the evidence is showing that as well. So I think I'll have to look at the article, but it was another country second to the state of Arizona. And I think that to be White Mountain Apache, you know, in the year 2020 is to be political regardless of your training, because your indigenous self-determination is intimately tied to you before any profession is tacked on to you. I don't know if you have anything to add to that as well, in terms of, you know, it's our responsibility as Native Americans in the East Coast will say, it's our original instructions and our responsibility to take care of the people, the community, the land, the seeds, the food, so that it'll be here in 7 generations and 7 generations beyond that. So I'm not sure if you have anything else to add in terms of, you know, your expertise as a medical doctor, and also your role as a healer. Really, you're a healer in terms of what our community needs, and also, you know, what do you want for our community? And just to be specific about that, you know, one of the things that I would want selfishly is a better relationship between our White Mountain Apache community and our IHS staff, and that includes from, you know, the head of the IHS, I don't know the specific person, but that's irrelevant, all the way down to the janitor, all the way down to the medic, the helicopter people, and the hospital medical team that receives us in Phoenix and Tucson and wherever. So I don't know if that makes sense, if you want to speak to that, as far as we need Apache hospital medical team. We need everyone to just be patient with our people. Our elders speak a second language. We need cultural competency and cultural humility. So I don't know if you want to speak to that.
You know, I worked for IHS for about 3 years here in Phoenix. So you know, I've seen a lot of different things, some good, some bad. You know, so, and I would just say for the community, I think it's a time, like for the whole world basically, and for myself, it's a time for reflection. It's a time to reevaluate, you know, what we're doing wrong, individually, you know, as a family or as a community, as a tribe, as a nation. You know, this virus is really showing us, you know, what is really lacking and what is weak in our system. And unfortunately, you know, I've been reading journals, you know, there's going to be more viruses. I hate to say that. I hate to bring some like bad news and stuff, but there's going to be more viruses, and there might be more pandemics, you know, 10, 15 years down the road, because this has happened before, and history is telling us it's going to happen again. So I hope this really enforces how we need to prepare ourselves. And like you said, maybe the tribe needs to teach all of us how to be more self-sustaining, learning how to grow, you know, have a garden. You know, my dad used to tell stories how there were cornfields all the way from, you know, on the river all the way up to Eastward. And, you know,
Wow.
now we don't see that. There's cornfields here and there, but I don't know if the soil is different or what's going on. You know, self-sustaining, you know, we all need to learn how to grow our food. I think from a medical perspective, and I speak for myself as well, we need to be healthier because unfortunately this virus likes to prey on the weakest, you know, and people who are obese, and I put myself in that category, you know, we're at high risk. And I know as Native Americans in general, you know, diabetes and obesity is really, really, really high. And maybe this is telling us
type 2, all the heart disease, right, doctor? All that. We're always number one on all of that.
And maybe this virus or somebody's trying to tell us, God or whoever, that we need to change our ways. We need to be healthier if we want to continue as an Apache people. And for IHS, you know, I like IHS. You know, they did a lot for me. I know it's free healthcare because of the treaties that we've got into, but I would tell people not to depend on the government because years and years and years, the United States government has failed Native Americans. And, you know, to put it in a different way, prisons are more funded than Native Americans. Prisoners have better health care than Native Americans.
The industrial complex ensures that through our tax our tax dollars. And this is for all the people who would say, oh, Natives don't pay taxes. Yes, we do. The minute we step off our territory, we pay, and even when we're on territory, we pay taxes. Go ahead.
Yeah. To those people, I would like to show you my tax returns, how much taxes I pay.
Exactly. So we don't even have time for them. Moving on. But yes, Dr. Bush, yes, I agree with you that we definitely need to not depend on that because history has already shown us all the evidence, 500 years of evidence. So keep going. Yeah,
so IHS, you know, unfortunately, I wouldn't put all my, you know, a lot of my confidence in IHS. I love the people there. They're hard workers, you know. The doctors, the nurses, the custodians, everybody there are hard workers. But it's a government system that is, I don't know if they're tailored to really advance Native American healthcare. If they really were, they would, you know, fund all the programs. It's severely underfunded. You know, there's still so many chronic diseases. So I don't know what the answer is, but I would just maybe as a tribe as a whole, we need to come up with something different. But
yeah. Okay. And then just to add to that, what, I guess, just to respond to your point earlier about I agree with you, doing better around food choice, healthier food choices, healthier action. I think a way that it was framed for me was, you know, challenge yourself to not sit as much. And so when I thought about it, instead of like, don't always sit or I'm always sitting for work, you know, and I think if I reframe that in my mind to be like, ooh, how can I challenge myself to not be sitting today? How can I challenge myself to stand during my meeting, you know, or whatnot? I'm just making stuff up. But that helps me to be a little bit more active, and it helps my heart with the blood flow. And I guess to get to my point of like, how do we as White Mountain Apache people, I don't know our median income, but how are we supposed to pick healthier foods when the policies and the tribal, local, county, state, federal policies fail us time and time again? We can't even get food stamps if we're a felon. So I guess, how do we want to bring hope around better food choices, because it's possible, you know, pre-contact and after colonial contact, our diabetes weren't this sky high. So it's possible. It's just going to take innovation and ingenuity. But I don't know if you want to respond to that, and then we'll wrap it up.
Yeah, you know, I kind of wanted to say something. It was funny when you were talking about moving. Actually, that's one of the things people that have COVID that we recommend them to move, because we need the blood to flow, because, you know, people who are infected with COVID, there's a high risk of getting blood clots in their legs or wherever. So it's
wow.
We encourage people like, keep moving. Don't lay in bed even though you don't feel good. Just keep moving, you know. So yeah, as far as the diet and all of that, you know, that's again, that's a tough one. You know, people I know on the reservation are like I'm pretty much living paycheck to paycheck. You know, they're given like, or you know, like a certain sum, you know, and you got to make that stretch. And you know, healthy food like vegetables and fruit, you know, from my experience, is when you buy them, if you don't eat it right away, they go bad like within a week. Yeah. And a lot of our tribal members need money, you know, food to be there for 2-3 weeks, because you don't know when, you know, the next paycheck or might come in. So and a lot of that, I think, is with in all of America. It's just we're very busy people. You know, we like things fast. We like fast food. We like, you know, processed food, food that, you know, processed meat. It's just one of the things that's part of the diet, and it's really hard to change, you know, to that kind of eating. So I don't know the answer to that. I guess maybe I don't know if we need a. It's one of those things. It's really, I don't have a good answer for that one.
Well, I think this would be a great opportunity to challenge our community members to get creative and really carve out what that is for them. This is an opportunity. The world is slowing down so that you can focus on your health, focus on your language, focus on your own healing, whatever that looks like for you. The world is literally, the earth is saying, you know, sit down, calm down, and you know, let's heal this if we're going to get through it together.
Yeah, I agree.
All right. Well, thank you so much for your time, and thank you so much for this. It's been really insightful and helpful.
Oh no, thank you for asking me to do this. It's funny because I always think to myself, like, how can I help my tribe? You know, because I work here in Scottsdale, Arizona, here at one of the hospitals, and eventually I'm going to work my way back to serving the tribes. I mean, I see a lot of tribal members in Scottsdale, like the Gila River and the Salt River, and Fort McDowell Apaches. But yeah, and it's kind of funny how this worked out. Like, I've always wanted to give back to my tribe, and eventually, you know, that's something I'm kind of headed towards. So, yeah.
Wow, that's great. And let's stay in contact, because I think that you would be a great consultant for having some non-Apache medical professionals come to the reservation and, you know, offer their services. So that's what we want to do during the call tomorrow, is really do a call to action to medical professionals. We want to set up some testing sites. I'm privileged in New York City that I can just pretty much go off of any sidewalk testing site and just stand in line for no longer than 15 minutes and get tested, and my results are texted to me the next day. So that's privilege, you know. And I want that for our community, because we're so remote and so rural. I guess my point with all that was that we need to be on that level of like directness and clarity. So anyway.
That's I totally agree. And hopefully Arizona is changing the political climate. We've been a very Republican conservative state, and typically they tend not to want to spend money, especially on Native Americans. But hopefully it's changing. Hopefully
we're purple now, right?
Purple state, yeah. And I totally agree with you. And sometimes we have like fundraisers for like the congressman here, and we actually had the mayor of Phoenix at our office. So these are kind of things that I would want to kind of bring their attention to. So
let's talk, because we want to create the political atmosphere that if you are any politician, from the president all the way down to a city board or a school board member, if you want to have White Mountain Apache support, you better have something on your platform that speaks to the COVID impact and how you're going to help the White Mountain Apache community as well as all of the other tribal communities in the state of New York. So that's kind of where I'm getting at, but we're not there yet. We still got to strategize. We appreciate your time.
Okay, thank you.
Thanks. We'll talk soon.
Okay, bye-bye.
Okay, bye.